The Rwandan Biomedical Center has warned the public against violations of COVID-19 preventive measures in public places. It is believed that some members of the public are showing complacency as the number of coronavirus cases has started to drop. However, health experts say failing to adhere to the protective measures will lead to another spike in cases. Details in this report.
In some parts of Kigali city markets, you find some traders and buyers not wearing face masks, others wearing them the wrong way, others do not observe social distancing, while other traders do not comply with the rule of working in shifts. When their shift ends, some decide to become street vendors, while others carry on their business activities outside market premises. Some people say that a reduction in the number of COVID-19 cases in the country triggered complacency towards adhering to preventive guidelines. As time passes, and also with the reduction in the number of cases, we took measures easy. Even some guidelines were eased. Plus, the number of recoveries increased. Before, we could hear 100 cases, but now it's between 4 and 10 cases. That's the reason.
Before things were so hard, cases were very many, but now numbers of new infections are reducing significantly. We should continue preventive guidelines because if we don't, we are likely to be put under lockdown again.
When people hear that the number of cases have reduced, they think that the pandemic is over. But for us who work from markets, we observe guidelines carefully, including social distancing. Some of the market leaders say that they continue to sensitize vendors, pointing out that the pandemic still exists and therefore no one should downplay the preventive guidelines since new cases are registered daily. When number of buyers is high, the market can receive approximately 3,000 people, which means only half of the number can enter. Even buyers are put in the order of lines with limited time to purchase commodity so that they can go out and give space to others. Even those people who dodge working from markets should be stopped so that they don't be the pathway for the spread of COVID-19. Though numbers have reduced gradually, people continue to die from the pandemic. We have 480 traders. Some work today, others work the following day. We urge everyone to make it a priority, not thinking that it concerns leaders and volunteers only. When you look around, some people no longer consider the preventive guidelines, but security organs follows them up. On the other hand, failure to comply with these regulations has become normal in public bus terminals. The Rwanda Biomedical Center (RBC) says downplaying the COVID-19 preventive guidelines can worsen the matter, as explained by the Director General of Rwanda Biomedical Center, Dr. Saben Sanzimana. There are times when we spent 3 days without registering any new case, but later it's changed. We witnessed that from our country, not outside. So COVID-19 is like other diseases. It might catch people by surprise if they don't decide to comply with the measures. So we do not wish to fail. The time we've spent with the virus, we've seen our strengths and weaknesses. When the number of COVID-19 cases reduce, it's an opportunity to strengthen the measures, like in congested places. People should continue washing hands and wearing face masks. Since the COVID-19 pandemic hit Rwanda on March 14th this year, more than 408,000 people have been infected. Among those, 74% have recovered from the virus, whereas 1,200 people are still sick. So far, COVID-19 has killed 31 people in Rwanda.
Biomedical Center in Rwanda warns against the violation of COVID-19.